Hello students. Today we'll be discussing about a very important topic, that is mediastinum. So let's just begin. Mediastinum. It is the middle space left in the thoracic cavity in between the two lungs, and it mainly comprises the heart enclosed in the pericardium. And the base of the heart is slightly tilted towards the left. This is the left, this is the right. Now let's just talk about the boundaries of mediastinum. Anteriorly lies the sternum. This is the sternum. Posteriorly are the vertebral column. These are mainly the thoracic vertebrae. Superiorly lies the thoracic inlet. It is mainly formed when the first rib attaches to the manubrium of the sternum and the first thoracic vertebrae. Inferiorly lies the diaphragm. And on each side are the mediastinal pleura. It is a part of the parietal or outer pleura of lungs that lines the chest cavity in the area between the lungs. Now, mediastinum is divided into superior mediastinum and inferior mediastinum by an imaginary plane. I repeat, by an imaginary plane passing through the sternal angle. I'll show it now. By an imaginary plane passing through the sternal angle, which we see in between the manubrium sterni and body of sternum, and the lower border of the body of fourth thoracic vertebrae. The inferior mediastinum is further divided into anterior, middle, and posterior mediastinum by the pericardium. It is the membrane which encloses the heart. I'll show it in the figure. This is the anterior mediastinum, middle mediastinum, and posterior mediastinum. Now let us first discuss about the superior mediastinum quickly, then we'll hop on to the inferior mediastinum. Superior mediastinum. Let's talk about its boundaries. Anteriorly lies the manubrium sterni, as we saw it in the figure above. Manubrium sterni. Posteriorly is covered by the upper fourth thoracic vertebrae, T1, T2, T3, and T4. Superiorly by the plane of thoracic inlet. Inferiorly by the imaginary plane we talked about earlier. And on each side lies the mediastinal plane. Now we will learn about the contents of superior mediastinum. First comes the thymus. Now we can learn this in this way, that the thymus is most anteriorly placed. Next comes the arch of aorta. We will not be discussing about it now. Behind it comes the trachea, and behind that comes the esophagus. This is the trachea, esophagus, and the most posteriorly placed is the thoracic duct. So this is how we can learn it. Next we have some of the muscles situated in the mediastinum, superior mediastinum. Sternohyoid. It originates from the upper and posterior part of manubrium. Sternothyroid. It originates from the manubrium below the origin of sternohyoid, as you can see in the figure. Sternohyoid, sternothyroid. Longus colli. It also originates from the transverse processes of C5 to T3 vertebrae. Next we have arteries. The arch of aorta. This is the arch of aorta, and the three of its major branches are the brachiocephalic artery, left common carotid artery, and the left subclavian artery. Next we'll see veins. Here we have the right and left brachiocephalic veins, superior vena cava, and left superior intercostal vein. It is not shown in the figure, no problem. Next we have nerves. It consists of vagus nerve, phrenic nerve, cardiac nerves of both sides, left recurrent laryngeal nerve. The most important are these two, vagus nerve and phrenic nerve. You need to remember these. And at last is the lymph nodes. paratracheal, brachiocephalic, tracheobronchial lymph nodes. Now we'll discuss about inferior mediastinum. The first part of inferior mediastinum is the anterior mediastinum. It is a narrow space in front of the pericardium and is overlapped by the anterior borders of both the lungs. Its boundaries are: anteriorly it is covered by the sternal body, posteriorly by the pericardium, and on each sides by the mediastinal pleura. It constitutes first arteries, mediastinal branches of internal thoracic artery. Second comes the lymph nodes with their lymphatics. Third, the sternopericardial ligaments. Fourth is the thymus. The lower part of thymus is situated in the anterior mediastinum, and the upper part of thymus is situated in the superior mediastinum as discussed earlier. Fifth, it is filled by the areolar tissue. Next comes the middle mediastinum. It is mainly occupied by the pericardium and its contents. Its boundaries are: anteriorly is covered by the sternopericardial ligaments, posteriorly by the esophagus, descending thoracic aorta, and azygous vein, and on each side by the mediastinal pleura. Its contents are the heart, the most important, arteries. First comes the ascending aorta. From this arch of aorta comes the ascending aorta, which is supplied by the left ventricle of the heart. Pulmonary trunk is shown in this figure, and the two pulmonary arteries. This is the left pulmonary artery and this is the right pulmonary artery. Next are the veins: the superior vena cava, azygous vein, right and left pulmonary veins. Fourth is the nerves: phrenic nerve and the deep cardiac plexus. Fifth are the lymph nodes, tracheobronchial nodes. The third mediastinum is the posterior mediastinum. It is bounded anteriorly by the pericardium, by the bifurcation of trachea, pulmonary vessels, and the posterior part of upper surface of diaphragm. I'll show it in the figure. The posterior part of upper surface of diaphragm, and posteriorly by the T5 to T12 thoracic vertebrae, and on each side by the mediastinal pleura. And its contents are the esophagus, artery, that is descending thoracic aorta, veins, azygous vein, hemiazygous vein, and accessory hemiazygous vein, nerves, vagi nerves, and the greater, lesser, and least splanchnic nerves. Next are the lymph nodes and lymphatics, posterior mediastinal lymph nodes, and the thoracic duct. Clinical anatomy of the mediastinum. It is a very crucial point for the exams. Compression of the mediastinal structures by any tumor gives rise to mediastinal syndrome. Obstruction of the superior vena cava causes the engorgement of veins or filling of blood into the veins. Obstruction of trachea causes dyspnea, which is difficulty in breathing. Obstruction of esophagus causes dysphagia, which is discomfort in swallowing. Obstruction of left recurrent laryngeal nerve causes dysphonia or difficulty in speaking. Obstruction of phrenic nerve causes paralysis of diaphragm on the side which it supplies. Obstruction of the intercostal nerves causes intercostal neuralgia or pain in the side where it supplies. Now we'll discuss a few points which can prove to be helpful in making your understanding more better. So in this figure, we see that this is the ascending aorta. By the way, you should know that this is the largest blood vessel in our body. Just a fact. This ascending aorta is being supplied by blood from the left ventricle of the heart. It is in the middle mediastinum. It is further connected to the arch of aorta, which is situated in the superior mediastinum. Next comes the descending thoracic aorta, which is situated in the posterior mediastinum. Next, we should know that the esophagus comes from the superior mediastinum from behind the heart and reaches the posterior mediastinum. And same goes with the thoracic duct. Similarly, we have learnt about the thymus. The upper part of the thymus lies in the superior mediastinum and the lower part lies in the anterior mediastinum. Here is a mnemonic to learn the contents of the superior mediastinum. PVT left battle. You can take a look on it. And here we have the arteries, veins, nerves and the lymph nodes of the superior mediastinum and parts of the inferior mediastinum in the tabular form. Hope it helps you. Thanks for watching.